A Medicare bill can quietly take hundreds of dollars from a retiree's budget each year. But for people with limited income and resources, programs may pay the Medicare Part B premium, and sometimes much more. In 2026, the rules have dollar limits, and knowing which program fits could make a real difference. Here is what to know before applying. Why Part B costs matter. Medicare Part B helps pay for doctor visits, outpatient care, preventive services, medical equipment, and many other services. In 2026, the standard Part B premium is $202.90 per month, or $2,434.80 across 12 months. Some people pay a different amount because of income or other Medicare rules. For a retiree living on a tight budget, that monthly bill can matter each month. Medicare Savings Programs, or MSPs, can help people with limited income and resources. These programs are administered through state Medicaid agencies, even though they help with Medicare costs. There are 4 main MSP categories. 3 can pay the Part B premium: QMB, SLM, and QI. The 4th, QDWI, mainly helps certain disabled workers with Part A premiums. Understanding the differences is important because qualifying for one program does not automatically mean receiving every type of assistance available. The QMB program. The Qualified Medicare Beneficiary, or QMB program, is generally the most comprehensive Medicare Savings Program. In 2026, the federal monthly income limit is $1,350 for an individual and $1,824 for a married couple in most states. The federal resource limit is $9,950 for an individual and $14,910 for a couple. QMB can pay the Part B premium and, when applicable, Part A premiums. It can also help with Medicare deductibles, co-insurance, and co-payments for covered services. That makes QMB different from programs that only pay the monthly premium. QMB beneficiaries also have important billing protections. Medicare providers and suppliers generally cannot bill QMB beneficiaries for Medicare-covered Part A and Part B cost-sharing. State rules can be more generous than guidelines, so these numbers should be treated as a starting point, not always the final answer. The state Medicaid agency makes the final eligibility decision for beneficiaries nationwide. The SLM program. The Specified Low-Income Medicare Beneficiary, or SLMB program, is for people whose income is above the QMB range but is limited. For 2026, the income limit is $1,616 for an individual and $2,184 for a married couple in most states. The resource limits are $9,950 for an individual and $14,910 for a couple. SLM mainly pays the Medicare Part B premium. Unlike QMB, it generally does not pay Medicare deductibles, co-insurance, or co-payments. That difference matters when comparing these programs. Someone who misses the QMB income limit may still qualify for SLM and have the Part B charge covered. Medicare also says some recipients receive extra help with prescription drug costs. State rules may differ, so someone slightly above the limit should still contact the state Medicaid agency. The table is a guide, not the final answer for every person. The QI program. The Qualifying Individual, or QI program, can help people whose income is too high for SLMB but still limited. In 2026, the monthly income limit is $1,816 for an individual and $2,455 for a married couple in most states. The resource limits are $9,950 for an individual and $14,910 for a couple. QI pays the Part B premium, but it has a difference. Funding is limited, and people must apply each year. States approve QI applications on a first-come, first-served basis, while giving priority to people who received QI benefits previously. QI is intended for people who do not qualify for other Medicaid benefits. Like SLM, QI recipients receive extra help with prescription drug costs. If someone falls just outside the SLM range, QI may be the next program to check. State review is necessary because eligibility rules can vary. The QDWI program. The Qualified Disabled and Working Individual, or QDWI program, is different from QMB, SLM, and QI. It does not focus on paying the Part B premium. Instead, QDWI can help pay the Medicare Part A premium for certain people who have a disability, are working, and lost premium-free Part A and disability benefits because they returned to work. In 2026, the monthly income limit is $5,405 for an individual and $7,299 for a married couple. In most states, the resource limit is $4,000 for an individual and $6,000 for a couple. These income limits are much higher, but the resource limits are lower than those for QMB, SLM, and QI. QDWI matters because it is one of the 4 official federal Medicare Savings Programs. However, someone specifically seeking Part B premium help should focus first on QMB, SLM, and QI. Who can qualify? Medicare Savings Programs are designed for people who have Medicare and meet financial rules, but the requirements depend on the program and state. QMB, SLMB, and QI target people with limited income and resources. QDWI serves a narrower group of disabled workers. Having a job does not automatically prevent someone from receiving assistance. Some states have higher limits or different ways of counting income and resources. Income can come from Social Security, pensions, wages, or other sources, but certain deductions or exclusions may apply. Resources can include money in bank accounts and other countable assets, while some items may be excluded. This is why people should not reject themselves based only on a calculation. The safest approach is to apply or ask the state Medicaid agency to review the complete situation. The state determines which program fits the applicant. What counts as resources? Income and resources are different, and confusing them can cause people to miss potential assistance. Income is money coming in, while resources refer to assets a person owns. For 2026, federal resource limits for QMB, SLM, and QI are $9,950 for an individual and $14,910 for a married couple. QDWI has resource limits of $4,000 and $6,000. However, Medicare.gov notes that some states have higher resource limits or may not count certain resources for QMB, SLMB, or QI. So the federal numbers are not always a pass or fail test. Different assets may also be treated differently under state rules. Before applying, gather bank information and other records, but do not assume every dollar or asset is counted the same way under state rules. The state Medicaid agency can explain which resources count under its rules and make the official eligibility decision. Why state rules matter? A common mistake is assuming every Medicare Savings Program works exactly the same way nationwide. Federal guidelines provide the basic framework, but states administer these programs and may offer more generous income or resource rules. Medicare.gov specifically says someone may qualify even when income or resources are higher than the limits. Alaska and Hawaii have higher income limits than most states. States may use different rules for counting certain income or resources. This matters because a person slightly above the limit could still qualify locally. The state Medicaid agency is therefore the place to confirm eligibility and submit an application. Medicare recommends contacting the state to apply. Do not rely on an online chart alone. Use figures as a guide, then let the state review the applicant's Medicare coverage, income, resources, and other circumstances before making an eligibility decision. How to apply? Applying for a Medicare Savings Program is handled through the state Medicaid agency. Before applying, gather Medicare information, Social Security or pension statements, wage information if applicable, and records showing resources. Then contact the state Medicaid office and ask about QMB, SLM, QI, and these programs. If an application is denied, the notice should explain the decision and appeal rights. A person whose income or resources change should check eligibility again because circumstances can affect benefits. QI is especially important to remember because it requires a new application each year. Also, do not confuse Medicare Savings Programs with Extra Help. MSPs focus on Medicare premiums and, for QMB, cost sharing. Extra Help focuses on Medicare Part D prescription drug costs. Some people who receive QMB, SLM, or QI also receive Extra Help, creating another source of savings for eligible beneficiaries. If this information helped, check your state Medicaid agency and Medicare.gov before making a decision. And remember, eligibility can change. Also, make sure to like this video, subscribe for more clear Medicare and money tips, and share it with someone who could benefit today. See you in the next one.